Right, a very good afternoon to all of you. Welcome to Neetu's family or Neetu's Academy Reading Live with me, 𝐉𝐮𝐧𝐞. How are you all? After a long time. Yeah? Did you all miss me? I'm sure the man have taken care of it, isn't it? So I was really looking forward to come in front of all of you. So yes, welcome to another live session with me, back again live in front of all of you. So yes, I know that it was a bit of a delay to start, usually we don't, but yeah, always better, isn't it? So nice to be back in front of all of you. Yes, 𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿 names at all of them, back again, and there were a few students who have asked, where am I? I'm still here, right in front of you with Neethu's family, yeah? Neethu's Academy is always there in front of it. Okay, so are you all able to hear me? Yes? So nice. Coach Chuji, good afternoon. Nice to see all of you. Saranya, Rakesh, how am I? I'm doing excellent. How about you all? Yes, all of you are doing good? Okay, so yes, was always there. Excellent. Nice to see a lot of no names. Yes, Swapna, Parameshwaran, good afternoon. Happy to see all of you as well. Sound is breaking, is it? Okay, let me see. Maybe. Now it is okay? Vaishnavi Prakash, good evening, a very good evening. So once again, right in front of all of you. So happy to be there, talking to you, even though virtually. As always, Abhirajan, good afternoon. No names. Always are welcome, isn't it? 𝐿𝐿, happy to see you, happy to see all of you as well. How am I? I'm doing excellent. Right, so Alina Faiz, good afternoon. Okay, fair enough. Kirtu, good afternoon. Rupal Hari, hello, after a long time. How am I doing? I'm doing excellent. Right, so nice that you all have been thinking, as I always think about what my students are doing, what are you all up to. So I used to see when you were all attending madam's classes, so I knew that all of you are always there. So nice, so happy to be in front of all of you. Excellent. Nimi Mary Abraham, good afternoon. So tell me, how have you been all these while? You're all doing good? Yes? Okay, fair enough. So nice. Did you all learn a lot of things? Happy to see that, few of you missed me. Fair enough. Right, Jackson Michael, good afternoon. A very good afternoon to all of you. Okay. So how is your learning going? Tell me. How is your learning going? Is it all doing good? Again, next our class is with you, sir. Yes, of course. Hope it's not boring for all of you. Yeah, echo sound, okay. Maybe we are trying to come up with a new way to come in front of all of you. So maybe a technical glitch can be, and please do bear with me. Okay. So 𝐿𝐿, after a long time, yes, after a long time, but happy to be in front of you. Maybe let me see if my microphone is the problem. I hope now at least you all will be able to hear me, yeah? Susmita Mohan, good afternoon. Ramya Manoj, good afternoon. Naibi Biju, good afternoon. Rijo Krish, sir, thank you so much. I cracked. Rijo, it is so nice to see your lovely score of 410. That is all your hard work. So absolutely good enough. So I wanted to come with a bang and you are giving me a double bang. Yeah, because Rijal is saying I've made it my dream with reading 410. Absolutely good enough. Congratulations to your hard work. Yeah, I'm so proud of your achievement. Alfie, no sound clarity. Now it is okay. I hope it is okay. Rijo, thank you so much. Femi, sir, after a long time. Yes, Femi, but yeah, happy to know that you're all there missing me. Okay, because I missed all of you. Coming in front of you was an absolute, even though at the time there was something which was not really a thing which I was not able to. So, yeah. So, as long as you're all there, happily waiting. Thank you. Jancy, some bass is there. Maybe I'm a bit too long away from audible. Maybe that can be trying to settle it. Okay. Let me see. If at all such kind of a thing, I'm very sorry for that inconvenience, but in days to come, you will not have a problem. Yeah. Jogum's problem is sound. Please clear it. We're trying, Jogum. We're definitely trying to clear that. We will definitely do our level best. Razia Sajid, good afternoon. Sheja Binoy. Echo, I do understand. Kirtu, no sir, you didn't miss me, is it? Okay. Twinkle, Robin, not clear. Sheja, voice is not clear. Now also it's not clear. Happy to see you, Alfie. Happy to see you as well. Yogeshwari, hi, how are you? I'm doing excellent, Yogeshwari. Thank you very much. Though I missed all of you, but yeah, apart from that, doing good. Rajimul, Pritesh, good afternoon. Okay. Kirtu, some kind of echo. Maybe. I'm not sure why is it. We're trying to rectify it. More echo, not clear. Okay. Miduna Nidash, no sir. You didn't miss me. Okay. Echo, okay. You're talking about echo, I know that. Yeah, we will definitely try to settle it. Okay, our backend team is definitely looking into it. We don't know why or where this echo is coming from. So, yeah. Tessie Abraham, good afternoon. Bibi also Thomas, her voice is not clear. Right. So, what we are going to do is, we'll do the 2 minutes thing. So, I'll give you 2 minutes of time where I'm going to make it to your part B. Okay, we will try to settle it so that you will have some time before we also try to rectify it. Yeah. So yes, the 2 minutes of your material will start as soon as the material pops up. So I will be the one who will be monitoring your time. So the 2 minutes of time and your material for today's part B, there you have it on the screen. Okay, please do the material and then we will discuss it. Okay, and the time starts now. Okay, even though I was in the back end, I was there. Okay, but there was few things where we had to. So now you will not miss. Okay, very happy to know that you all missed me. But yeah, we missed all of you, but you have been there all the time with us. So what else could we ask for, isn't it? Thank you so much for those participation. 𝐉𝐵 good afternoon. Tinu Augustine, good afternoon. Is the sound okay now? A bit better? I hope it is. Abhirajan done. Right, now because you all have found the answers, is it? I hope all of you have got an answer. Would you be kind enough to tell me what is the answer and where you got that answer from? Good afternoon, Betty. So yes, tell me, what is your answer for B and where you got that answer from? That where is the most important factor. So please let me know what is the answer. Clear? Fair enough. That is why, you see, when you say something, we are always obliged to that. Okay, thank you very much, because we were trying to do something new. Okay, and that's how, yeah, sound is better. Thank you very much. And it will not happen again. Yeah, okay. Aswati, yes. Betty, sound is better. Alfie, sound is clear. Good enough. Anjali, where is Vandana ma'am? Vandana madam is also with us. She's also not going to go anywhere. So we will be coming in and on and off, yeah? So do pop in. Donna, Anna, John, Navamaya, I'm doing excellent. Thank you very much. Okay. So 𝐉𝐵 good afternoon. See, it's always there, isn't it? So all of us from Neetu's family is always going to come in front of you. It's just a matter of we're trying to give some, you know, like fresh faces in between. So that's all. 𝐉𝐵 good afternoon. Right, now tell me, what is your answer and where you got that answer from? That where is the most important factor? Tell me whether it is A, B or C. What is your answer? Do shoot. So let's see, what is your answer? What is your answer? I could see a lot of students are joining, so happy. Okay. Now tell me, what is your answer for the question? Litu George, good afternoon. Very good afternoon, or very much of, you know, so nice. No matter wherever you are from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. Now shoot, what is your answer? I'm eagerly waiting to see what are you going to type, whether it is A, B or C. What is the answer? Tell me. Razia is the first one to respond. Good enough. B from the last portion. Okay, fair enough. So I have my first answer, which is there, which is B from Razia. I want all of you to come in, because see, it is you to get involved in the active participation. You have to participate on the aspect, because you have to start telling it is for me, not for me, for you. Yeah, because I'm here to learn. Let it be right or wrong, it doesn't matter. Okay, I want you to do on the aspect of saying, yeah, I'm here with a purpose. I want you to tell, okay, this is my answer. Ramya Anish, good afternoon. Good afternoon. So tell me, what are your answers? Do shoot. What are your answers? Tell me. I have only one person who have told me so far. Razia is the only one to say yes, it is B. How about others? How about others? Tell me. Nobody's going to tell me what is the answer? That's bad. Tell me what is your answer. See, it's always good, isn't it? You should know what is the answer and what can be the answer. Okay, so yeah, I hope all of you have an answer. So I'm just gonna change the material and we're gonna discuss it. Okay, so yeah, so this is the question which I shared. Bharati is also saying B. Good enough. So at least I have two people who are saying B is the answer. Okay, let's see, doesn't matter whether it is A, B or C, because all the three options can be a possibility. Okay, now part B. So what are the things that you have to really do? See, part B, you are expected to do a thing called elimination method. Okay, now what is elimination method? You are simply going to eliminate the option that is wrong. Okay, in order to do that, you have to really read the question, underline the keywords in the question. Alright, now see the question. Why? These kind of WH questions are very, very, very cynical. Okay, you have to always remember that. So why clinical medication review gain prominence in recent times? So they are asking a question on the aspect, why has this gained? Okay, so you are expected to read it properly. Okay, what is the main idea behind this clinical medication review? Understood? So why? Now let's see the answer options. Is it due to the inability to accommodate patients in hospitals? So inability to accommodate, or is it to provide patient safety for better health outcomes? So is it to provide patient safety, or is it inability to accommodate? Or the option C is inappropriate medications are reflecting in hospital admission. So because of a lot of inappropriate medication, more people are getting admitted into the hospital. Is that why the clinical medication review has gained its prominence? Understood the question now? I hope you understood the question. Okay, now go and read the extract. As you read, eliminate the option and go if it comes. Understood? Now let's see. Manual extract, clinical medical review. Medication is by far the most common form of medical intervention. Okay, they are saying, see, medication is more important. Fair enough. A general entry. 4 out of 5 people over 75 years take a prescription medicine, and 36% are taking 4 or more drugs. Understood? So what are they saying? 4 out of 5 people over they are taking prescription medicine, and of which 36% are taking more than 4 to 5 medicines. However, now these kind of cohesive markers are very important. However, we also know that up to 50% of drugs are not taken as prescribed. So what are they saying? Although we know that these people are taking medicine, 50% of people are not taking the medicines as prescribed. Okay, now 2 to 3 many drugs in common use can cause problems, and that adverse reactions to medicines are implicated in 5 to 17% of hospital admissions. So what are they saying? Because of this wrong taking of medicine, 5 to 17% of people are getting admitted in the hospitals. This leads to difficult decisions, particularly with the frail elderly. Now frail, it's a beautiful word which you can always use. Frail means physically weak or easily damaged, broken, harm, anything can be frail. Yeah, whether to initiate or discontinue medication. So they are making it into, they're saying, okay, because this can lead to difficulty, because these people are getting admitted, so we don't know, these are all fragile people, who are, whether to initiate or discontinue medication. Now medication review is recognized. Now our question is what? Clinical medication review. So they are saying medication review is recognized as a cornerstone of medicines preventing unnecessary ill health and avoiding wastage. See, it's not just about preventing, but it is also to avoid wastage. Okay, so involving patients in prescribing decisions, supporting them in taking their medicines is a key part of improving patient safety, health outcomes, and satisfaction with clinical care. Now let's go and see whether to eliminate, how to eliminate. See, inability to accommodate patients in hospital, they are nowhere it is mentioning, saying that it is the inability. There's no inability and all. Okay, the concern is because these people are not taking the prescribed medicine, that is affecting the hospital admission. So now see, B, 2 people out of all those watching have said to provide patient safety for better health outcomes. Is that the reason why clinical medication review? You have not understood the question. See, they are saying involving patients in prescribing decisions and supporting them in taking their medicines is a key part of improving patient safety. Not only patient safety, health outcomes and satisfaction with clinical care also. Okay, so it is not to provide patient safety for better health outcomes. It is to show the clinical medication review. Reason why they have gained prominence is because inappropriate medications are reflecting in 5 to 17% of hospital admission. That is the reason. So the answer for today's question is C. Unfortunately, none of my students have told me that they have got the answer, because only 2 told me. 2 said B. So people who have got wrong, no problem, because you have been corrected. People who have got it right, again, congratulations, you have got it right as well. Understood? Is there any doubt why the answer was that and why it is not this? Yes, did you understand? If so, give me a quick thumbs up. Let me see how many of you understood. Is there any doubts? Please do shoot. Is there any doubt? Or if you have understood, please do let me know. Yes, I understood. Just put a thumbs up. Yes, put a thumbs up. Let's see. How many of you understood the question and how many of you are clear with what I've just told? Okay, yes, Reshma, nice to see you as well. Reshma, I've understood. Excellent. Georgie, once again. Right, see the question, Georgie. What is the question saying? The question is asking you why clinical medication review has gained prominence. Okay, see, when the patient are getting admitted into the hospital, that is the reason why this gained prominence. The question, see, you have to always understand. Part B is about understanding the question first. Please understand the question, then you'll find the answers. Clear? So I could see a lot of people have understood. Kirtu understood, Ashwati understood, Razia understood, Abhirajan understood, Ashwati understood, Reba understood, Naibi understood, Jasmine understood, Sneha understood, Kirtu understood. Good enough. Georgie, now you're okay. Kochu understood. Fair enough. Nice. At least the way you respond have not yet gone at any given time. Every time when we come, even when Madam was taking, your response have been stunning. So hats off to each one of you. Yogeshwari understood, Donna clear, Ruth Angel understood, Georgie understood. Very good. So you're all clever students. It's just a matter of finding the right technique into it. So the right technique to do part B is read the question, understand the question, then read the answer options, underline the keywords in the answer option, read the paragraph. As you read, do the elimination. Rajimol Pratish understood. Excellent. So now because you all understood, are you all ready for the next one? Did you all see today's material? Yes, Juna Thomas understood. Did you all see today's material? So today's material is lupus nephritis. Gopika Gopin understood. Right. So before going into the material, would you be kind enough to tell me how you felt about today's material? Okay. Give us some valuable feedback. I want you to tell me. Okay. And how many minutes you took to complete the material? Betty Matthew understood. Okay. Fair enough. Ashwati Vijayan, yes. Okay, fair enough. Excellent. So I want 2 answers. One, how you felt about today's material. How many minutes you took in order to complete the material. See, when you are attending the live session, please do complete the material and then enter, so that we can grow together. Okay, Abhirajan, yes, done the material. So I hope all of you have done the material, just out of curiosity, because I could see a lot of new names. Okay, even though I've been watching the names which keeps on popping up, but is there anybody who's attending the live for the very first time? If so, can you just say, yes, I am attending the live for the very first time. And where are you from? I love to know where my students are from. Okay, it's not for any reason, because I am a person who would always say I know people across the globe. Okay, Abhirajan is saying easy material. I took 9 minutes and 56 minutes. Absolutely good enough. Good. I like that precision, because students are always there. Okay, because we have been talking about the importance of getting on time. Good enough. Joji says yes. Joycey says yes. Kirtu, I've seen new words in this material. Very good. Nice observation, Kirtu. Because see, when we do a material, we want to make sure that you are all exposed to a different vocabulary. Good enough. I appreciate it, Kirtu. Absolutely good enough. Ashwati Vijayan, easy. Kochus is saying easy, 10 minutes. Okay, fair enough. Ruth Angel is saying yes. Ashwati Anish, I'm attending for the first time. Ashwati, very nice. Thank you so much for letting us know. May I know where you're from, and welcome to Neetu's Academy Reading Live with me. Benila Robin, yes, I'm first time. Benila, would you be kind enough to tell me where are you from as well, because I want to know where my students are from. Because every time when I go to those places, I can say, yes, I know people in here. Okay, don't worry, I'm not going to disturb you, but I'd love to say that. Yogeshwari is also saying easy one. So happy to know that you're all saying it is easy. So that means you have been growing. The 1 month that I was not there, you've been absolutely growing. So that shows that, you know, the time that you have said, yeah, it is 10 minutes. And you have said it is easy. It's not because it is easy. It is because of the way that you have evolved. See, evolution is very important. From where you are, you have evolved on a daily basis. Every time, as what Kirtu said, yeah, I got new words. I got a new material to do. That's the power of learning. Benila, I'm from Chennai. Okay, very nice. I had a lot of students from Chennai. Now I have Benila from Chennai as well. Good. So nice. Next time when I'm in Chennai, I'll definitely give you a ring. Okay. Right. So I'm not going to keep you waiting, because I want you to take the material, take the pencil. See, students, I want you to know that the only thing that you will have when you are doing this linguistic exams is you should have only a pencil with you, nothing else. Okay, don't have pens, don't have markers, don't have anything else. Highlighters, no. Only pencil. Biji Kunjamolraj, sir, watching your live classes first time. Thank you very much, Biji. May I know where you're from as well? So welcome to Neetu's Academy. Okay. Now, without wasting your valuable time, so please do click the, I'm sorry, not the click. I am supposed to click. You are supposed to tick. And I want you to tell me how much of your score is. Okay, we'll discuss. So the material will be popping up on the screen. So as soon as the material pops up, we'll start discussing the answers. Right. Now the material will be popping up on the screen, and you are expected to see the material now. Okay, as what you said the materials are easy. So let's say Bijimol, I'm from Kuwait. I had a lot of students from Kuwait as well. So yeah, Middle East is a lot of students. Okay. Now all of you have the pen and pencil with you. I'm sorry, pencil and your material with you. Now let's go and see question. What are the things? See, part A, you always have to remember, it's very different. This will be the first part that you will see when you go and do the exam. So what are you to do? Okay, see, first and the foremost important thing, part A, you are only going to get 15 minutes, and in that 15 minutes you are expected to tackle 20 questions. This is the first and the foremost important thing that you have to remember. Okay, now the strategy changes. Okay, the strategy for part A is called skimming and scanning. What's the strategy called? Skimming and scanning. Now skimming means quick look. Scanning means detail look. That's simple difference. Okay, scanning, you're very much aware, isn't it? You are all, you know, from medical background. Why do you do a scan? You want to go in depth. So that's the same thing that we do in here. Okay, but it's a combination. So what are you to do when you are skimming? See, skimming, you are supposed to underline the keywords. What are you going to do? You're going to underline the keywords. Now, what are these keywords? Okay, you have to always remember this. You have to by heart this. Okay, all of you should do that. Okay, so if you want, do jot it down. See, every time I tell my students very, very precisely. See, when you do attend a class, or even when you're going for a training, you have to have a pen and a paper with you, or a pencil and a paper with you, or a book, because you have to jot down, because it's not that you wouldn't remember. That's how human is. So you have to remember. So I'm just gonna refresh all of you what are the keywords. So keywords are headings, subheadings, letters given in bold letters, italics, numbers, bullet forms, abbreviations, proper nouns, or any new terminology. Okay, if it's a pictorial representation, the headings. These are your keywords. Clear? Now, apart from doing keywords, students doesn't realize the importance of underlining the words. Okay, it has to be individual words. Don't simply write or underline big sentences. Very good, Sharmi, Lisa. You have absolutely typed in. So very sweet of you. Yeah. Thank you very much. Now I'm just going to show you. See, and also skimming. Okay, they say you are expected to tackle in 1 to 2 minutes. But we in 𝐕 Academy believe we know that with our training we empower our students to tackle it in 1 minute of time. Now, how would you tackle this in 1 minute of time? See, it's very simple. We have how many texts? How many texts in part A? We have 4 texts. These 4 texts are based on one common theme. So today's common theme, lupus nephritis. So we have 4 texts: text A, text B, text C, and text D. Each would be different to each other. So what are you to do? You are supposed to take only 15 seconds per text. So that means you will finish it by 1 minute. Clear? Right. Now, how are you doing the skimming? Don't read in-depth details and all. Okay? You have to read through it as quickly as possible. And as you read, you're going to underline the keywords. I'm just going to show you. Just see if you are able to understand what I am reading. Okay? So lupus nephritis is the inflammation and damage to the kidney and the system. 𝐕𝐶 is the most common form of lupus, and lupus is an autoimmune to the immune system and attack this issue, and the lung lupus can damage the brain, heart, joint, skin, and the part lupus nephritis affect the kidney and controlling the blood pressure and blood volume, filtering the waste of urine, maintaining the right level of blood, salt, acid, minerals, regulating hormone levels. It can lead to a variety of serious health problems, including kidney failure and renal disease. It is more likely to get lupus in women 9 out of 10. So these are numbers, and between the ages of 15 and 43, men are black, Native American, Hispanic, Latino. That's it. Now what? I have taken about 10 to 15 seconds. Likewise, you're gonna skim through each text. Okay? Now see, if you really look into text B, what are saying? Diagnosis. So this is an important keyword. So what are the diagnoses? There are a lot of tests: blood tests, urine tests, and kidney biopsy, clearance test, lot of things. You have to underline each of these, and like that you have to go see again. Text C, what are they saying? Signs and symptoms. So you should remember this. What does each text conveys to you? Okay, now if a question in 1 to 7 says where are a lot of signs presented, you don't have to worry, isn't it? It is straight in C. That is how you skim. Understood what is skimming? Quick look. And as you look, you should remember. So signs and symptoms. Now see, what is text D about? Text D is about a lot of therapy. So anything about treatment, where you should go to text D. Understood what is skimming? Now we are going to go to the question. Okay, see, please understand, part A will have Princey, happy to see you as well. Thank you very much, because your love and affection has been immaculate. Okay, I have to tell you that. I was thinking that, like maybe students wouldn't remember me, but you all do remember. Thank you. Rachel Samuel, I am Rachel Samuel from England, first time. Happy Rachel. Nice meeting you, and welcome to 𝐕 Academy Reading Live. So Rachel is already there in most of our students' dream country. So yes. Now after this, you have to always remember 20 questions are divided into 3 types of question. Okay, this should be by hearted as well. You should by heart the numbers, you should by heart what type of questions are those, and the instructions. Okay, so first type of question that you're going to encounter is match the following questions. The second type of question that you're going to encounter is short answer questions, and the third type of question that you're going to encounter is fill in the blanks questions. Okay, so now for the first type of question. So the first type of question, what is that? The question number starts from 1 to 7. So you should always remember 1 to 7 is match the following questions, where you are expected to mark only A, B, C, D. And the instruction clearly says you may use any of these letters more than once. Sir, Sharmi is saying, sir, always like to mark the keywords in the question is the best strategy to choose the answers. Of course it is. Okay, because your eyes will look for the keywords only. Alright, now we'll see. I'm going to tell you, as what Sharmi says is an absolute reality. You have to mark in the question as well. Then only you will be able to, because part A is purely keyword referencing. It's synonymous language being used. So that is why there are certain words which can be given as such. Most of it would be synonyms. Okay, not paraphrasing. Now, question number 1. So they are saying the initial treatment regime for lupus nephritis. So initial treatment regime, where are they talking about treatment? I told you, you have to always see these kind of things. See, even without looking into, I can say the answer will be in D. Why? That is the only place where treatment is mentioned, isn't it? So where are they saying the initial treatment is what? Done. Understood why keywords? You are expected. See, if at all you underline the whole sentences like that, you wouldn't. Your eyes will not catch those keywords that is needed. So if your keywords, and if you can differentiate this, 1 to 7 is just a piece of cake. It will be, you can do that in 1 minute of time. Okay, now bodily regions typically succumb to the effects of lupus nephritis. So succumb means it is prone to. Okay, bodily region. So which part of the body? So where are they talking about? Different parts of the body. Definitely I know when I underlined it is there in A. Why? Because it clearly says in addition to your kidneys, it can damage your brain, heart, joint, skin. So very straight. Answer is A. See, I want you to, if you can, please do type the answers as well. Yeah, that's all okay. Now, question 3. The presence of what constituent in urine induces a frothy appearance? So again, something is present, constituent, where in urine? Frothy. So what makes urine frothy? So where it should all come from? Is it a sign? Yes, it is a sign. So where are they talking about sign? Sign is there in C. I don't have to really look into, but because we learn, we're not gonna learn like by hearting it on the answers. Where are they saying? Okay, proteinuria, protein in the urine, which often causes the urine to look foamy. Foamy means frothy. So that's called synonyms. So the answer is C. Understood? So far I think all of you are clear with me. Are we on the same page? I hope we are on the same page, yeah? When is dual agent, dual means two, maintenance therapy initiated? Do you really need a second option for this? No. Therapy. Go straight to D. Now where are they talking about? It is clearly mentioned, isn't it? Why? Dual agent, 2 agents. So that is 4. So the answer is there. Now question number 5. The etiology of weight gain in individuals with lupus nephritis. So again, see, is it asking you about a sign or a symptom? Yes, sign and symptom is where? It is in C. Now let's see. Now you're going to scan. Now this is what? Skimming and scanning. Skimming I understood. Okay. It is in C. Now I'm going to scan. So where are they talking about weight gain and all? Okay, there it is. Weight gain due to excess fluid in your body. So that is the problem. So the answer is, you're not asked to find what is the reason, where is it mentioned. So the answer is C. Who, now this WH question, who are predisposed to a higher risk of experiencing lupus nephritis? Who means definitely it should aim somewhere on the aspect of human beings or people. Okay, so where are they going to talk about this? Who? So do you have a second thought? Where have we mentioned about a lot of people, different types of people? Black, Native American, women are more prone. So the answer is A. Understood? Now question 7. The most accurate technique for assessing the rate of kidney filtration. So where are they talking about kidney filtration? It should definitely in some diagnosis, isn't it? So diagnosis is mentioned in B. Now is there anywhere which is mentioned about? Is there anywhere? It should be there, isn't it? Because it clearly says they may also directly test how quickly it leaves your blood. This is the most accurate test for kidney filtration speed. So the answer to that question is D. Now the next set of questions. The next set of questions starts from 8 to 14. You are expected to by heart 8 to 14. These kind of questions are called short answer questions, where the instruction is also to be by hearted. The instruction clearly says you are expected to, the answer can be a word, it can be a short phrase. Short phrase means anything between 2 to 3 words, or it can be a group of words, group of numbers, or a combination of both. Okay, Yogeshwari knows my pattern, so she is telling me she has got 7 out of 7. Abhiraj and I've got 7 out of 7. Absolutely good enough. I'm so proud of each one of you, all of you. Okay, because it is how we grow. Together we grow. We tell you, you do it, and we all grow. Prince Ibnu 7, absolutely good enough, good enough. Keep it up, keep it up. Right, now question number 8. Okay, what facial manifestation characterized it by its red hue, that shows about the color, okay, might arise in individuals with lupus nephritis? So they are asking very specifically something which is seen on the face characterized by the hue. So it is a sign. Yes, definitely. So sign means go to C. Now let's go and scan the area. So where are they saying about something which is red? Is there anywhere which says it is about red and anything? Yes, there are, isn't it? Red hue is there, on the skin is there, face is there, facial manifestation is there. So what is the only thing which is there? What is happening? The answer is skin rash. Very straight. SKIN space RASH. Now, what are the two blood-based products? Products means singular or plural? Tell me. Products means singular or plural? Are. These are how you look into the question when you read. Okay. So, products are plural. So that means definitely more than one would be there. Eliminated by the renal filtration. So it's something to do with your kidney. What are they? What are the things? So definitely it should be under some diagnosis, isn't it? It should secrete something or discrete something. So where are they saying? A doctor will look for the elevated levels of waste products in your in your blood, such as creatinine and urea. So what are the waste products that you're talking about? It is creatine, creatine, and urea. Absolutely right, Joycey. Creatine and urea. Good enough, good enough. I like the participation that you're doing, even though, yeah, Vaninath, creatine and urea, good enough, good enough. Keep on, get yourself occupied so that you will learn, because progressive learning is the most important thing. Betty, how to get online materials before live class? Betty, we have the very same page that you're watching. We have posted it there, and also we have an exclusive reading Telegram page which is available. If you have not yet joined our reading Telegram page, if you are there in our official Telegram page, there you can send a request to get enrolled in the reading exclusive page, because after the scrutinizing only we accept you there. Okay, because we want genuine students on the aspect, because the other students should not be disturbed. We have n number of fraudulent people available, so we try to avoid them. Okay, so we have an exclusive reading Telegram page. That is the place where you get the first hand information. But because we want to make sure that all of you are doing it, the very same page that you're watching, that is also posted there. So if you have not yet joined our page, we have a lot of social media presence. We have it. Please do join. So if you have not yet clicked the like button, please do click the like button. If you have not yet clicked the subscribe button, please do click the subscribe button. If you have not clicked the follow button, please do click the follow button. You'll not miss Alright. Now, what adjunct therapy? Now that is a beautiful word, isn't it? Adjunct, a thing. That means it is in combination with something, or a supplementary kind of a thing. Therapy is warranted after the success of glucocorticoids and IV cyclophosphamide in maintenance regime. So where are they talking about? So definitely in D. Now adjunct therapy means something which goes along with it. Okay, so GC is there, IV cyclophosphamide is there, so maintenance therapy is there, and the other therapy is also there. So the answer should only be combination, because therapy is already given in the question. You are not expected to repeat the word which is already given in the question. So the answer should only be combination. Am I clear? I hope I'm clear. Excellent. Now question 11. What term encapsulate? That means it is about including the swelling of the lower body or periorbital region and caused by fluid retention. Joji, it's not combination therapy. That's what I just told you, because therapy is already given in the question. You're not supposed to write therapy, because the question, see, which adjunct therapy is already there. So only combination. Yes, Anu Thomas combination, Susmin combination, Kirtu combination, absolutely right. So the term, and what is the term that is known for swelling of the body because of the fluid? Yes, absolutely right, it is edema. So edema is a swelling due to fluid buildup. You are aware of it, isn't it? Asha Charian combination, Vani Nath, edema, Dona, edema, good enough, Reba, edema, absolutely. Georgie understood, very good. So now see, this is also a question which is a bit tricky. Which age brackets? Age brackets means something which starts and which ends. Okay, so between is already understood there. Okay, do women primarily succumb? That means they are more prone to scourge of lupus. Now scourge, okay, that's scourge. Okay, we always lead scourge. No, R is silent there, so it is scourge. That means suffering from lupus. Absolutely right, Joycey. It is 15 and 54. Please do not include between, because between is already there in the question. So the answer is 15 and 18. Donna 16? No, 15. Yeah, right. Now question number 13. What technique is deemed quintessential? So that means very much important, or representing the most perfect, is what is called as quintessential. Standard in confirming the diagnosis of lupus. So diagnosing of lupus, where? Go straight to B. That's where a lot of diagnoses are mentioned. So where are they going to talk about? So which technique is more important? So kidney biopsy is considered as the gold standard method. So that means it is the most prominent one. So the answer is very simple, kidney biopsy. Clear? Good enough. Question 14. What underlying factor is responsible for the development of lupus? So something which causes, what is the most important thing? Okay, so definitely in A it clearly says, I'm just gonna clear it out for you so that you won't have a problem or you don't get confused. Yeah, right. So lupus nephritis is an inflammation and damage in your kidney due to systemic lupus erythematosus. So the simplest one is SLE. Because the abbreviation is given as such, you are expected to use the abbreviated form. Clear? Now that is also done and dusted. Now for the final one, question number 15 to 20. These are called fill in the blanks question, where you are expected to only write what is missing. Okay, so instruction is very similar to short answer question, so do as what it is. Even an article you are not supposed to repeat. See, is already mentioned, so you're not supposed to write again. In short answer question, article is not a problem. Okay, here article is also a problem. So you are only expected to write what is missing. A dash is employed in assessing how kidney filters water products, typically 𝐻𝐿 clearance test. So 𝐻𝐿 clearance test, where are they talking about? It's very straight. Go to B. So 𝐻𝐿, where is it? Yes, 𝐻𝐿 is there. So which one? What are they going to do? It is going to use contrast dye. Okay, so it is contrast dye. CONTRASTDYE. Question number 16. Lupus can culminate. That means it can lead to severe outcomes like dash and end-stage renal disease. So where are they talking about? Definitely in A, isn't it? That's how the thing starts with. Yeah. So where are they talking about? It says it can lead to a variety of serious health problems, yes, and including kidney failure and end-stage renal disease. So that's a very straight answer. So kidney failure. So KIDNEYFAILURE. Lupus is characterized by an autoimmune response prompting the dash to target the body's own tissues. So again, it's another straight answer, isn't it? Where you get that from A only. So it is going to target your own thing. So what are they going to do? So lupus is an autoimmune. Yes, the keyword is there, that triggers the immune system to attack your tissues. So who is going to attack? It is your immune system. IMMUNESYSTEM. Question 18. Very good, Anu. Immune system, Joycey, good enough. Manifestation. Okay, that means symptoms of lupus. So where symptoms is always there in C. This is how you skim. Now once you get all those keywords approximately following the onset of initial lupus symptoms. So go to symptom, onset, initial. So where are they saying? Symptoms of lupus nephritis tend to develop about 5 years after the lupus system first appear, initial. So what is the only thing which is missing? Only thing which is missing is 5 years. Sharmi right, Alfie right, Susmin right, Donna right, Kirtu right. Yes, very good. 5 years only. Don't write about, because about is already given in the question as approximately. Now the penultimate question. Dash can serve as both the initial and sometimes be the solitary. Solitary means what? Solitary should be something which you always have to remember. The first, the alone, a lot of things. Okay, that's called synonyms. Okay, signs of SLE. So where are they talking about SLE? There are two places, but now the solitary, the other symptoms have to be looked into. So first, solitary only. So manifestation of SLE. So what is that? Lupus nephritis. So very straight answer and the easy one. Charian, structure 5 years? No, 5 years only. Yeah. So the answer is LUPUSNEPHRITIS. Now the ultimate question for today. If the target is not attained with the induction therapy, go to D, skimmed. Now scanning, induction not attained, GC, MMF and add. So now go and scan. So where are they saying? Induction therapy is there, GC is there, MMF is there. So not attained. So what is that? Add voclosporin and belimumab. So the answer is a 2 or 3 word answer. voclosporin and voclosporin/BELIMUMAB. 12th answer is 15 and 44. So I have completed my 20 questions and it's high time. If you have any doubts, please do clarify. If not, what do? Let me know what are your total scores. Tell me. If there is any doubts, please do clarify. If not, please do let me know what are your total scores. I hope all of you are there. If you have any doubts, you're always welcome. We're all here to assist you. Reba Rijo, absolutely stunning, 20 out of 20. Excellent, excellent. I'm so happy. Okay, I'm so happy that you're all getting it. Kirtu 19, excellent, very good, keep it up. Abhirajan 20, absolutely good enough. Jansi, thank you, pleasure. Princy Binu, thank you so much, thank you very much. Good enough. Excellent. So I'm so happy that you're all, getting a lot of scores and all. Abhirajan, thank you. Okay, thank you. Any doubts? Please do let me know. If there is any doubts, yes, I'm happy, more than happy to make it corrected. Alfie, thank you very much. So again, we had a student who made and said, I came and the first thing that I saw about that is a student have cleared with a reading of 410. Absolutely good enough. I'm so proud, isn't it, when students get those scores, even though it is their effort. We from Neetu's family are always happy. Alright, Kirtu, thank you so much, you're really amazing, thank you very much. You all are absolutely amazing, okay, because of you all, your participation, your time, that's what we are. Alright, Nona, thank you. Benila, thank you. So as since all of you have started, Tessie, thank you. So all of you have started saying thank you, so that means there is no doubt. Until and unless I see you all tomorrow, adios from me. God bless you all, take care and stay blessed.